Welcome back to the Mountain Man Medical YouTube channel. Thanks for hanging out. In today's video, we're going to talk a little bit about this clip.
How'd you get away?
I took us up that ridge, and when Bratton was distracted, I jumped.
Jumped? He just let you go?
No, he took a couple of shots. And I think that angle was wrong, so he just took off.
With Hank?
Yeah, Bratton needed Hank to carry the money.
It's gonna hurt. There you go. Help carry the money, so that's what this is all about?
He had a lot of it. Too much for one person to carry, so he needed Hank. You have to find my brother. Please.
I will. The first thing we need to do is get you help, though. Once we do that, I can track them. Now, we gotta get you back up there, all right? I'm not gonna lie to you, it's gonna hurt like hell. But you can do it. You be brave.
Okay.
You need to concentrate on your breathing, okay? So you do 4 deep breaths in. Just keep doing that, nice and calm. We're gonna be fine. Get you out of here.
All right, so we can see from that clip that we have an obvious deformity in that left arm. So this is going to be our first indication that there's something isn't right. Anytime we look at the human body and we notice an abnormality like that, we want to take note of it and kind of figure out what that problem is. And in this case, it's going to be because of a fracture. So the reason why we see that deformity is because that bone has fractured and moved. So now we see that big lump the way that it is. The reason why this is dangerous is because the ends of those bones are very, very sharp. Often, instead of those bones moving and just becoming a lump, because they're so sharp, they can actually poke through the tissue and the skin there and become what's called an open fracture. 2 main types of fractures are your open fractures and your closed fractures. This one in particular is a closed fracture, or at least we assume so because the shirt is covering it. But it could become an open fracture where that bone pushes through the skin. And this can be even worse of a condition. The reason why this is bad is because open fractures are at a substantial risk of infection. So we need to make sure that we're keeping this as clean as possible. Additionally, the ends of those bones are so sharp that they can cut you when you're trying to take care of them. It's not uncommon for the first responder or the rescuer to get cut on the ends of those bones if they're trying to take care of them because they are so sharp. First and foremost, when we're taking care of this, is we need to try to stabilize this injury as much as possible. We don't want those ends of those bones wiggling around and continue to lacerate the tissue inside of that arm. If this happens, then we could absolutely have some severed arteries that we're going to need to take care of. Stabilization of this injury is vital so that we don't continue to cause injury to our casualty. So we're going to talk about some things that we can do to kind of minimize that and help get this person to a higher echelon of care so that they can get taken care of and get this bone reset. Ideally, you're going to have a nice packed out trauma kit full of all of the things that you need to make this situation go great. But unfortunately, you might not be able to do that. If you're caught out in the woods, you might be able to find yourself some sticks to add some excellent splinting material and get that limb stabilized. I have a video that I shot a while back that I'll drop a link into up here, where you can kind of check that out about making your own splints when you're out in the woods. But if you happen to have a trauma kit with a foldable splint like we saw in that clip, we're going to show you how to use that today. First and foremost, we got to cut them out of their clothes. We got to see exactly what it is that we're dealing with. Often, having a good set of trauma cures in your equipment is super important so that we can cut this person out of their clothes and we're not trying to manipulate all of these shirts as we're trying to get them off of this person. There's a lot of these injuries where moving them around will cause them substantial pain and potentially more damage. So what we want to do is limit that as much as possible by having some trauma shears so that we can cut this person's clothes off of them. Good set like this will get the work done. Now we can open it up and kind of expose exactly what's going on with our injury, and we want to be very, very careful here. If that person is conscious and able to support that injury themselves, they're probably going to be doing that in something that looks very similar to this. This is one of those standard, I've hurt my arm injury poses. So if we see someone standing like this, we can start to kind of infer that they might have some damage to that arm that we're going to be taking care of. On top of that, we're going to take note of any swelling, redness, edema, If we have any abrasions, contusions, or any abnormalities like deformities, we see any weird bumps, or if this arm is at a weird angle, clearly that's going to tell us that something's not right and we're going to need to take care of that. One of the things that we need to be concerned about here is that if we don't have a pulse, if we have a fracture in this arm and I try to find a radial pulse on this person and I can't find it, there's a good chance that that artery is kinked in there and we're not getting good blood supply to that tissue. The reason why this is significant is because a lack of oxygen to the tissue can cause that tissue to die, essentially kind of like a tourniquet. So the tissue isn't getting all of the oxygen that it needs and it will slowly start to die. If this goes on for long enough, then they might need to have that limb amputated. So if we feel for a radial pulse and we can't find one, then we need to try to maneuver that as carefully as possible back into its original position so that we can find that pulse. If we are seeing an extensive amount of bleeding because of an open fracture and that bone has severed an artery, perhaps the brachial artery that's running along the inside of your arm here, then we might need to apply a tourniquet to control that bleeding. You might need to control that bleeding with the tourniquet, so we want to make sure that we have one handy for when we need it. Fractures are pretty nasty. It's actually one of the more superior things of our modern medical technology that fractures really aren't that big of a deal anymore. They used to be a death sentence. With the invention of antibiotics and anesthesia, that has dramatically improved the quality of life and your survival chances from a fracture. It used to be completely the opposite. So today, it's more of an inconvenience. Once we have this bleeding completely controlled with a tourniquet, then we can kind of move on to the rest of this procedure. One of the things that we need to do is make sure that we stabilize it so those ends of the bone aren't wiggling around, and we're going to need something to use that with, and today we're using our Mountain Man Medical moldable splint. It comes in two different versions. We've got this rolled version here, and then we also have the flat version so that you can pack it down into your kits a little more easily, but this is how you use it. We're going to unroll it and try to get it doubled back on itself to give us the best possible platform to splint this material. We pull it out and we're going to try to judge it for the break. If we have the fracture here, we want to make sure that we're splinting this above and below. And then we also want to incorporate this joint here at the elbow as well to improve the comfort. So we're going to come up here and try to position this and get this splint so that it's more customized to this exact casualty. One of the things that might also be beneficial is if they could reach up and grip it around. And we'll try to position this in wherever it's going to be the most comfortable. Then we're just going to take it and roll it on the sides. And this is going to help improve the stability and the rigidity something a little bit like that. So once we have that and we can kind of gauge it, this is all going to be done hopefully with the casualty kind of holding and supporting their own arm for the most part. And then what we're going to do is make sure that we wrap it with copious amounts of gauze. We want to try to make this as comfortable as possible for our casualty. We don't want any places where hot spots can develop. One of the problems that can happen is that this is sitting there, you can get some pressure sores from this being all wrapped up. So we want to try to limit that as much as possible. This is one of the problems with making your own splints out of sticks. Lots of little knobs and not really the best material. Sometimes you got to make do, right? But if we have something like this that can kind of limit the amount of those hot spots developing, limit the risk to our casualty, and increase their comfort a little bit, which is what we want to do. Having lots of gauze in your kit means that you've got lots of options for a lot of different types of wounds. Not only is this fantastic and essential for wound packing and controlling bleeding, but we can also use it in a pinch to stabilize and pad our makeshift or our splint. Now this comes packed down and vacuum packed, so you get a lot of gauze to make sure that you can use it for whatever you need to. But all we're gonna do is we're just gonna wrap this around a bunch of times. It's nice if you've got help, but if you don't, you just gotta make do. Essentially all we're doing is wrapping this around just to provide a little extra padding. All right, a little bit of padding, nice, but it's also an option to use one of these triangular bandages, or as I know them, as a cravat. This is another one of those fantastic multi-purpose items. I can use this as wound packing. I can also use this as a sling and a swath for this exact type of injury where we might need to support and help stabilize a wound so that we can transport or hopefully have an ambulatory casualty that can walk out on their own out of this really bad situation. But to do that, we might need to sling and swath them. This is a fantastic option for all of your trauma kits. If you can put this in there, it will increase the number of wounds that you can take care of and the number of people that you can take care of. It's one of those fantastic multi-purpose items, and for this, we're gonna use it to just continue to pad our splint. Now we have a nice padded splint. It's going to be nice and cozy for our casualty. And we're going to put this on top and try to get this totally wrapped up. Now, one of the things that you can use is if you don't need it for bleeding control, we can use this for wrapping up our injury. This is our Elias bandage from TacMed Solutions. This is the best pressure dressing on the market and also a great multi-purpose thing that we can use. Now, it comes with quite a bit of gauze packed in here as well. So we can use this to continue to pad our wounds or for whatever else we need to. In fact, I might save this and tuck it back down into this packaging, tuck this into a pocket in case I need it for later, right? Resource management is important out there in an emergency, and making sure we've got the gear we need is important. So what I'm gonna do is I'm gonna take this and I'm just gonna use this pressure dressing to get this nice and tied down. And hopefully we're gonna be going as gently as we can with this person, but because this arm is not attached to anybody, it's a little awkward. Another item you might store in your trauma kit is going to be a SWAT tee. This will essentially fill that exact same role as this pressure dressing and helping you to get this splint all tied down and nice and snug on our casualty. It also acts as a tourniquet and a bunch of other things as well. So this is a fantastic multi-use item. I encourage everybody to have one as a backup tourniquet, not as your primary. Put this in your trauma kit and help extend your resources. After we've got this all nice and wrapped up, we want to check PMS, pulse, motor, and sensory. We want to make sure that this isn't so tight that it's cutting off circulation to the rest of this arm. Ideally, we have circulation. We've got this positioned in a way that the arteries are not compromised and we have good blood flow to this hand. But we don't know that until we take a nice pulse and also checking their cap refill. So we're going to squeeze the nail and we're going to watch it go white and return back to normal, and it should be nice and fast. If it stays white, then we're going to know that this person is not getting adequate blood flow to the rest of their body, and there's very concerning, and we need to get this person transported as quickly as possible. Now, we're probably already going to be doing that, but we are going to know that this is a more dangerous situation and we need to go as quickly as we can so we can save this limb. Additionally, we're going to check motor. If we can get them to try to wiggle their fingers, that would be a nice thing to see that their tendons and everything are still working order. And then also ask them if they can identify which finger that you're touching. So we have them close their eyes or look away and we ask them which of the digits that we're interacting with. And if they can't identify that, that could be an indication of nerve damage and again, is very concerning. All right, guys, that's all I got for you. Thanks for hanging out in this little impromptu class about splints. Splints are important. We want to make sure that we understand how to take care of fractures and how dangerous they can really be for people. They can kill you if you don't know what you're doing. So if we can pay attention to that, we can know a little bit of skills, we can take care of the people around us. Appreciate everybody hanging it out. Don't forget to head over to Mountain Man Medical and check out our Yellowstone and Wind River trauma kits. Be ready for whatever the mountain throws at you. I'll catch you guys in the next one.